Hey guys, Kamina the coach here. In my car in a parking lot in the United States. I think my last video was from Hong Kong, so a story for a different day. So at the request of somebody from my group, Americans of Color Teaching Abroad, I'm going to attempt to cover my experience with medical and healthcare professionals while abroad. I don't know why I never thought about this. It is one of the huge reasons why I stay abroad, and it would be very beneficial for people to know. Unfortunately, I can't talk about family care because I don't have children, so all I can talk about is my perspective as a woman in the countries that I've been to where I have seen medical professionals. So first of all, we'll talk about China. Saudi Arabia, Oman, the UAE. I didn't go to the doctor in the UAE. Iraq, also I didn't go to the doctor in Iraq. Mexico and Thailand. Yeah. Okay, so here we go. So China. Don't go to the doctor in China. So somebody in the group, somebody in my teacher's group actually had surgery in China, and as far as I know, she had a favorable experience. However, the vast majority of people that I know that have been to the doctor in China did not have good experiences. I got very, very, very sick. I'm assuming probably the flu. So sick that it hurt to touch my skin, hurt to swallow. Hurt to physically swallow, not just my throat was sore. It was a really bad experience. And I eventually had to go to the doctor. I had to take a translator with me, and she was so scared of me that she didn't even want to give me an injection because she wasn't sure if, I don't know, tall black people still take the same dosage as Chinese people. I'm not sure what her deal was, but she wasn't rude or anything. She was just clueless. I had a toenail fall off, and ultimately it was probably from either the shoe being too tight or the nail being too long and the shoe being pressing down on it, causing the bed underneath to separate from the nail. Most likely. I suspected it might have been a fungus, so I was hoping that the doctor would give me a fungal cream. I don't think it was a fungus in hindsight because it didn't smell or anything. Anyways, TMI. So I went to this hospital, and first of all, there's no heating or air in this hospital. About 6 doctors came out, also in their winter coats. It was in the middle of winter, and huddled around me, speaking to each other really in curious tones, like they were all very curious, looking at my foot. It was a very unfavorable experience. Now, mind you, this was in small. Both of these experiences were in small towns in China. Now, I did go to a hospital in Shanghai, on the outskirts of Shanghai, and it was okay, but still, the people didn't speak English, and this was a larger, more modern hospital. And it took a very long time to be seen. My insurance did cover everything. Again, I just revert back to, if you can help it, maybe avoid China, going to doctor in China. Or if you're in a city like Shanghai, Shenzhen, or Beijing, maybe go to a very Western hospital. I've never even seen a Western doctor or heard of a Western doctor in China. Also remember, it's a communistic society, so these doctors and lawyers and teachers are receiving the same salary that everyone else. It's regulated like that. So, they're not really getting any extra benefit from this job. So anyways, all right, 5 minutes on China. Okay, so moving on, we'll talk about Saudi Arabia. Saudi Arabia is where I had surgery last May. Saudi Arabia has some very good hospitals. However, it just depends on how good your insurance is. So last year when I had surgery, I had very mediocre, almost bottom of the barrel insurance. So my doctor was amazing. Now my doctor is British Egyptian. My doctor was amazing. And this is kind of unusual in Saudi Arabia. I don't know for the top tier hospitals, but my experience for the most part in Saudi Arabia, especially with OBGYNs, first of all, Saudi Arabia is still a segregated Islamic country. So you're not supposed to be having sex unless you're married. So one of the questions they're going to ask you is if you're a virgin. And then if you're not a virgin, they're going to be questioning you about why aren't you a virgin? Well, are you married? And if you're not married, why aren't you a virgin? So anyways, my doctor who was from the UK, we didn't go through all that. So he was awesome. Also, men aren't supposed to touch women that aren't their wives. And my doctor was amazing. Like, he held my hand a lot. He hugged me. When I was in recovery in the hospital, that was really important because I was in a lot of pain. And his support was pivotal in all of this. Now, having said all that, he's no longer in Saudi Arabia. So, yeah, he couldn't take it anymore. My stay in the hospital was very unpleasant. The level of painkillers they gave me was not sufficient to counteract the level of pain that I had. And you'll find this in a lot of countries that what they're allowed to give isn't exactly the same as what you would get in the United States. However, I did only pay $150 for this surgery, and that money wasn't even for the surgery. It was just so that I could have a private room. If I would have been okay with a shared room, I wouldn't have had to pay anything for this surgery at all. So I was in the hospital. Eventually, so I decided to go home. I probably needed another day in the hospital. I've talked before about Saudiization and Emiratization. Anyways, the Gulf countries are essentially kicking people out. So what's happened is there's a huge nursing shortage. So I was on the maternity ward, and there were like 20 patients and only 2 nurses. That is completely unacceptable. I actually had to have a nurse friend come help me, and she like snapped at them. She was like, what's going on? But it really isn't their fault. They were just really, really overworked. So I didn't have anybody to walk me. I didn't have anybody telling me to breathe, so I didn't get like blood clots. And I don't know exactly, I'm not a medical professional, but I know that there is a lot of stuff that comes after surgery that should have happened that didn't, because there's just not enough nurses. Now, like I said, I was at a bottom of the barrel hospital. Now, I know people have had good experiences in Saudi Arabia, but I also had a friend who had a baby in Saudi Arabia, and this was many years ago, 2013-14. She was a teacher who got married there. She got pregnant, had a baby at one of the top tier hospitals. They ended up having to do an epidural and a C-section, and she was telling them that she could feel what they were doing. Well, first of all, they broke her water and was pushing on her, which apparently isn't supposed to happen. Then the epidural was wearing off and she could feel it, and she told them, and they didn't believe her. And then she's like trying to control herself not to scream, and she eventually kicked her foot. So in kicking her foot, they realized that the epidural wasn't working, so they ended up putting her out. So ended up being a very traumatic experience for her. And even though now she's back in the United States, I doubt she'll have another child. It was pretty traumatic for her, and ended up inducing gallbladder attacks. I guess she had gallstones, but had never had really any problems until that event. So it was pretty traumatic for her. My surgery, honestly, was pretty traumatic. I had my IV was bleeding and nobody washed me. But ultimately, still for me, it was worth it for me, because I never would have got that in the United States. So for me, it was worth it. The residual effect of having had the surgery is worth it. God, I feel so much better. I also, by the way, saw 3 gastroenterologists there and had a condition diagnosed that was not diagnosed in the United States. This was also at one of the top tier hospitals back when I had the good insurance, because I've been in Saudi Arabia 3 or 4 times, maybe 5. So this was at a top tier hospital, and I saw one of the best gastroenterologists in the country. And I was diagnosed with an ulcer, a chronic ulcer, when nobody else had any idea what was wrong with me. And my gastro here in the United States was like, oh, it's just, it's something little, don't worry about it. And that was 10 years ago. And now it's grown substantially, whereas we might have been able to do something for it back then. We can't now. So anyways, so if we had to do a 1 to 10 scale, I would give China maybe a 3, a 2. And I would give Saudi Arabia about a 6 or a 7 for overseas healthcare. So Saudi Arabia to Oman. In Oman, we were restricted, very restricted, and I was in a small village-ish type town, but I loved my OBGYN. She was awesome, from Syria. Lower standards you'd have to expect. They don't have to go to school quite as long, but she's the one who told me, she's the one who did, I don't remember what test it was, but she's the one who talked to me about the fact that I had fibroids. And though a doctor had mentioned it, no one had ever really talked to me about the fact that I had fibroids. So she's the one who found that. I really, really liked her. Very, very personable. You'll probably find that a lot of doctors, so most of the doctors in Saudi Arabia are Egyptian. Most. You'll find some Jordanians, some Indians. Majority are Egyptian. In Oman, I think majority are Syrian. I could be wrong, but same thing. You'll find Egyptians, Syrians, Indians in Oman. I'm not sure what healthcare is like in a bigger city like Muscat. There's only Muscat in Oman. There's only Muscat, Sohar, and Salalah as far as bigger cities go. I was in a town called Sur, and so it's pretty small, and I was restricted where I could go, but I was relatively pleased. I had to go to the emergency room one day, and they ended up giving me fluids for something. I'm not sure what I had, but I was treated pretty well. The cleanliness was pretty good. If something major would have happened, I would have been nervous. The hospital is just very basic, kind of rudimentary. So yeah, I would have been nervous to have something big in Oman. But let's talk about prescriptions as well. China also, you have to have a prescription for everything. You can't just walk in and buy antibiotics. Saudi Arabia has changed recently. Gotta love this new guy in charge. Used to be able to buy antibiotics and anything but a controlled substance over the counter. Now you need a prescription for that as well. Oman has always been like that. Their sultan is very Western minded. So there was a cream I don't know, that I needed for my face that I couldn't get unless I went to a dermatologist and got a prescription. So definitely need prescriptions in Oman. And you're probably, if you're in Muscat, you're probably going to get a much, much better care. There are a lot of expats in Oman, but these small towns, not so much. So Oman, UAE, no, didn't go to the doctor there. Iraq, I did actually go to the doctor in Iraq. I did. I actually I got a physical at a very sketchy hospital. I got a physical at a very sketchy hospital, had to take a translator with me. A little scary. I wouldn't recommend it. But I was in a small town in northern Iraq, in Kurdistan, small town. So, and like I said, I had a translator. And I also I was having pretty intense anxiety problems, and I was hoping that I could get prescribed a temporary supply of Xanax because I was really anxious. And what did he give me? He did actually give me some Xanax. He did give me a prescription for Xanax while I was there. And in some places, the pharmacist would actually give it to you over the counter. They weren't supposed to, but in some places they would. So I actually went and saw a psychiatrist, and he gave me a prescription for Xanax, just temporary. It was pretty stressful living there. Oh, I also saw same thing, really stressful living in the UAE. Also, prescriptions are very Western style in the UAE. I was very angry. I couldn't even get melatonin in the UAE. So I went and saw a psychiatrist for my stress and anxiety. I don't need that anymore, by the way. I've self-regulated. Thank the universe. But a little melatonin here and there. So I went and saw a psychiatrist in the UAE, and he gave me like one pill. He was like, use it sparingly. And he ordered a whole bunch of blood work that cost me an arm and a leg. And because I worked for a shady school, I didn't have insurance. I would assume that people who work for good schools in the UAE have much better experiences. You'll find much more westernized doctors and hospitals there, but that wasn't my experience because I didn't have any insurance. So I didn't have an opportunity to experience a good hospital in the UAE. And I've never heard anybody really talk about it. So that's UAE, Iraq, Mexico. I saw a gastroenterologist, definitely needed to speak Spanish, but my Spanish wasn't highly technical. My Spanish wasn't anywhere technical enough. So thank goodness the receptionist spoke a good deal of English. My Spanish is about 70% out of 100 scale. My Spanish is about 70%, but you really need technical medical terms to be able to talk to a doctor about this stuff. So I went and I basically just wanted to see, and I saw a very good gastro, but still I was in a small region in Mexico. I saw the best gastro in the area, and he essentially mimicked the same things that the other doctors had said, that my condition is chronic, I needed to be careful what I eat, moderate stress, blah, blah, blah. I know that seeing a doctor in Mexico can be a lot better, but you need to be in a bigger spot. So I was in a very, very rural countryside type area. Medical is one of the reasons why I'm going to Mexico. A lot of their doctors study in the United States, but you may need to go to a bigger city if you're in a small place or a more touristy type city. I gotta wrap this up. Okay, let me see. Mexico, Thailand. So Thailand was an excellent experience for medical. I understand why people go there for medical procedures. A lot of people go there for plastic surgery. Mexico too, by the way. A lot of people go there for dental procedures and plastic surgery. Thailand, I went for a physical in Thailand. I had an EKG, a chest x-ray, HIV test, and I saw a doctor for less than $100 out of pocket. I didn't have insurance there. Fabulous experience. Now their English isn't so great, or at least not. I went to a very middle of the row hospital. Their English wasn't great, but it didn't matter. When I tell you they were on it, they were on it. It was very, very clean. They were very, very efficient. Everybody was nice. It was a wonderful experience. Wonderful experience. I don't want to live in Thailand ever, but if you need to pop in somewhere and you don't have insurance to have something medical done, Thailand is a good choice for that. So I'm going to go ahead and wrap this up because it's run really long and people keep messaging me. So I really hope this helps you in regards to thinking about medical for living and working overseas. Kamina the Coach, wishing you love, light, peace, and joy. Until next time, peace.